Hi, CPI. My name is Jerry Dufresne. I've been at Transitions of Western Illinois for 3 years, and I'm an outpatient therapist here. And I've been a certified instructor in nonviolent crisis intervention since 1984.
Hi, and I'm Rich Zeidler. I've been at Transitions for 35 years, and I've been a CPI instructor since 1990.
We're really happy to be able to tell you how nonviolent crisis intervention has helped us at Transitions. We're a community mental health center. So Rich, what kind of impact has nonviolent crisis intervention had at Transitions in the 21 years you've been teaching?
Well, I think it's had a tremendous impact. We've based a lot of our incident reporting systems, our follow-up, our post-vention activities based on the CPI models. Our behavior incident report begins right after the release phase in the verbal escalation continuum, and anything above release we actually have to have people fill out a behavior incident report explaining the entire system. During post-vention we use a lot of the same coping models that CPI has taught us, and as we go through the post-vention with individuals. Anytime there's a behavior incident, that means somebody has escalated beyond the point of release, there is some post-vention that's done not just with a supervisor or a coworker, but with our Human Rights Committee, where we go and we present what we did at the Human Rights Committee, and at that point we discuss how we can do it better so that we don't have things escalating to that point next time. So, you know, and I've been always wanting to ask you, Jerry, since you've been an instructor for so long and you just arrived at Transitions here recently, have you noticed anything that relates to CPI and the quality of the interventions with our people here since they've been trained for so long?
Yeah, actually I have. My first week here, I had to physically control a young boy, and I was so impressed that the people who assisted me knew what they were doing, and I'm just not really used to everybody being trained. I like that everybody's trained, from the receptionist to the maintenance worker to the therapist to the direct support professionals, everybody. And that's because everybody comes in contact with our clients every single day, and so it's very nice to know that we can trust what's happening. And in the 3 years I've been here, that's the only time I've ever had to use a physical control, and the only time I've ever heard of one on my side of the building.
Yeah, and on the I serve a lot of people with developmental disabilities, whereas you're on the mental health side. Our agency is quite large and serves all the multiple populations as well as children. But on our side, we rarely use the physical, but we use the verbal constantly. Yeah. And we do a lot of I do a lot of teaching and mentoring of staff, and we'll sit down and we'll talk about now, when we dealt with this client, where were they on the verbal escalation continuum? Where were they on that behavior levels? Where were they, and what should we do, and did we do it that way? And as we work through that process, our staff are learning much better skills in how to deal with individuals when they become upset and acting out.
Okay, thanks, Rich.
So, thank you.
And we want to really thank CPI for developing nonviolent crisis intervention, because we see it working every single day here at Transitions. Thanks!